Priory Healthcare is probably one of the biggest independent healthcare companies in Europe. We provide psychiatric facilities all over the UK, ranging from secure units, education, care homes, acute hospitals, specialist units.
And at the moment you're looking to build a new facility at Monks Lane in Newbury. Tell us a bit about what the kind of plans are for that. What would that be there to do?
Well, the new care home is one that we're doing in conjunction with Berkshire Healthcare Trust. It's been 3 years in the planning, and we finally got to the stage where we got planning permission to start the build programme, and it'll probably take about another 12 to 18 months from now.
Now that the planning application has gone through, is it kind of all systems go in that sense? As soon as you can get on site, you start building?
Well, I wish it was that simple. But of course, what we have to do is we have to have a lot of consultation, because we're dealing with a group of vulnerable adults who live in Reading at the moment. So we have to consult with them, their families, the people who currently care for them. So we've got 3 or 4 subgroups going on, looking at their needs, the accommodation needs, what the facility is going to look like, how it's going to be furnished. And all of that needs to come together before we actually get into the proper build phase of the programme.
So what's the kind of next step in part of that consultation? Is it just literally just having a chat with the people that essentially would use the facility itself? And also, what about the residents that live quite close by as well? Do you consult with them too?
We've had a consultation with the local residents. I was involved. Obviously, some of their concerns were around that greenfield site being developed. But now that that's been clarified, I'm hoping that they'll understand, it is a good need in terms of the service we're providing. I'm hoping that they'll support us and get on board with some of the projects that we want to do. But the consultation will probably go on for some time with the residents in Reading and their families, because we have a high-level steering group with Berkshire Healthcare Trust, and we have 2 subgroups. One's clinical, looking at the needs of the patients, and the other subgroup is to deal with the build accommodation side. And we want to make sure the patients who are currently residing at Prospect Park are as involved as much as they can be, because it's going to be their home for quite a number of years. So we want them to get involved in how the place looks, the decor, the furnishings, and that could be quite a process. It won't be quick.
Why are you making the move in the first place? Obviously, as you say, that all these residents are currently in Reading. Why move them to Newbury?
That's fairly simple. It's because you have to go back a bit in history. These patients were patients from probably 7 years ago, when Prospect Park originally was built. Before that, the patients lived at Fairmile Hospital. And when Fairmile Hospital closed down, they were moved into Prospect Park. Everybody, I think, recognises that it's the wrong environment for these patients to be. They need a more homely, caring environment in the community, not a big hospital in the middle of Reading where perhaps their needs aren't being as well cared for as they can be.
Can you tell us anything about the kind of residents that you're going to have at Monks Lane?
Yeah, they're all adults that have got mental disorder. In other words, they've got long-standing mental health problems. Some of them are quite elderly and infirm. Others are quite active in the sense that they go in and out every day, accessing parts of the community. Some have got the ability to do their own shopping, go to workshops and day centres and skill centres. Others can't go out without the support of staff. And it's hoped that we can integrate those services around them in the Newbury area.